Hello there. My name is Dr. Dennis Mihalatos, and I'm the Director of Echocardiography at St. Francis Hospital in Roslyn, New York.
I'm Bob Biederman, cardiologist at Allegheny General in Pittsburgh, Pennsylvania, where I'm the Director of the Cardiac MRI program.
Okay, our next case is a 76-year-old man with coronary artery disease and ischemic cardiomyopathy that had a recent non-ST segment elevation MI and was again transferred to our hospital for further management. Further significant history is now they were experiencing acute renal insufficiency. Cardiac cath showed patent grafts, but a native circumflex that was 90% stenose that was eventually stented. No LV gram was done secondary to renal insufficiency, and an echo was ordered. These are the images that we can see, and we have obviously we can see some significant diminution in ejection fraction. You have reasonably well endocardium seen in the parasternal lung axis, some of the lateral wall missing on the short axis. And furthermore, again, on these apical views, these are our Achilles heel. We're missing the apex and we're missing the lateral wall. So there's a lot left to be seen in this patient. Furthermore, other images here, our 2-chamber and 3-chamber view do not fully show the endocardium, necessitating the use of DEFINITY. So do we have more than 2 or more segments that are not well seen? Yes. So that is an indication for DEFINITY. Here we could have very nice endocardial borders on their parasternal lung. We see the whole endocardium, nothing is missing, and we have a significantly reduced ejection fraction consistent with a history of the ischemic cardiomyopathy. Furthermore, here we see an area that does not take up contrast. So this area, this defect in the lateral wall, lateral apical wall on 4-chamber is consistent with the thrombus. And this thrombus may not look like your usual thrombi that are pedunculated or moving, but it's more lamellar. And it's important to realize the presence of lamellar thrombi. This is very obvious. However, at times, these thrombi could also just affect the apical views, and all you could see is that you have a defect, a lack of DEFINITY in the apex, and there's flattening of the apex. This flattening is slanted, but other times it's just the apex is flattened and you could never get a nice pointy apex. Without having seen this before, this pattern, you are not going to make the diagnosis. So it's very important to notice that not all thrombi are obvious, and not all thrombi are easy to diagnose, and not all thrombi look the same. So this was a thrombus, otherwise not seen with your traditional 2D pictures without any DEFINITY. And this again leads to a appropriate anticoagulation, which is going to be a very important point in this patient's management. So over time and time again, we see how valuable DEFINITY is in everyday garden variety cases and effective in clinical management.
I like it. Not all thrombi are created equal. It's important to recognize the different structures and phenotypes of those thrombi. You will miss a few if you're not exposed to them. You're looking for the whack you in the face thrombi that's moving around, it's wiggling, it's got little fingers on it. Sometimes it's these little subtle, these laminar ones, or these pedunculated ones you just may not see whatsoever.
And those are the ones that I've picked up doing QA at the hospital. Those are the ones that end up getting missed.
Absolutely.
Let's review the important safety information for DEFINITY. DEFINITY Vial 4 Perflutrin Lipid Microsphere Injectable Suspension. Indications. Activated DEFINITY Perflutrin Lipid Microsphere Injectable Suspension is indicated for use in patients with suboptimal echocardiograms to opacify the left ventricular chamber and to improve the delineation of the left ventricular endocardial border. Contraindications. Do not administer DEFINITY to patients with known or suspected hypersensitivity to perfluorine lipid microsphere or its components, such as polyethylene glycol, PEG. Important safety information. Warning. Serious cardiopulmonary reactions, including fatalities, have occurred uncommonly during or following perfluorine-containing microsphere administration. See warnings and precautions. 5.1. Most serious reactions occur within 30 minutes of administration. Assess all patients for the presence of any condition that precludes DEFINITY administration. See contraindications. 4. Always have resuscitation equipment and trained personnel readily available. In post-marketing use, rare but serious cardiopulmonary or hypersensitivity reactions have been reported during or shortly following perfluorine and PEG-containing microsphere administration. See adverse reactions. 6. The risk for these reactions may be increased among patients with unstable cardiopulmonary conditions and/or with pre-existing PEG hypersensitivity. See adverse reactions. 6.2. It is not always possible to reliably establish a causal relationship to drug exposure due to the presence of underlying conditions. Please see full prescribing information, including boxed warning, regarding serious cardiopulmonary reactions. Full prescribing information is available at DefinityImaging.com from a Lantheus sales representative or by contacting Lantheus customer service at 1-800-299-3431.